Hey, so I saw Miss Tanaka down in the ED. She's a 32-year-old female that came in with a one-day history of nausea and vomiting. It started out with generalized abdominal pain, then it moved more towards the right lower quadrant. She's endorsing some anorexia, but it hasn't had any fever or chills. Her other medical history, she does have a one-time episode of pelvic inflammatory disease about last year. It was mostly left-sided abdominal pain. No other medical problems. Is allergic to penicillin. She has one sexual partner. They use protection all the time, and her last menstrual cycle was about 2 weeks ago. On exam, she does have some abdominal tenderness, specifically rebound in the right lower quadrant, and a positive Rothschild sign. Otherwise, her pelvic exam and rectal exam are normal. On laboratory workup, her white count's 13. She has a left shift, but the rest of her labs are normal, including her creatinine, her platelets, and her coags.
Great. Based on what you've told me, what's on your differential diagnosis?
So everything we have right now, I would say highest on the list is appendicitis. It could be some other things like a tubo-ovarian abscess or pelvic inflammatory disease. I think those things are less likely because she had a normal pelvic exam. We could also consider things like IBD, but again, her rectal exam is normal. She isn't endorsing any diarrhea, and she has no family history of IBD. Since she is female, other things to think about would be whether or not this is like an ectopic pregnancy. We do have a beta HCG pending to hopefully rule that out. And then also, it could be something really rare, like a Meckel's diverticulum, but I don't think that that's likely. I think the most likely things would be appendicitis.
Okay. What workup would you like to do?
In addition to things we have pending, I would also like to discuss a CT scan. I don't think it's warranted for everyone. Her Alvarado score is 9. But I think that the CT scan will help us delineate whether or not this is appendicitis and can help us and talk to her about need for an operation.
Sure. And what are you going to consent her for?
If the CT scan findings do confirm appendicitis and we see some, right lower quadrant straining, thickened appendix, plus or minus fecal lift, I would talk to her about a laparoscopic appendectomy and discuss the risks and benefits of that procedure, which would include, pain, infection, either superficial or deep, and then injury to other organs. And if everything goes smoothly, she could go home the next day.
All right. Sounds great. Let's proceed.
Thanks.